Hi, hello, good morning, everybody. How are you doing? My name is Tobi Amadasun. I'm a clinical pharmacist and partner at Watton Medical Practice. I tried so hard to get to Cornwall today because the thought of getting to Cornwall, I didn't realize how far you were from Norfolk. I sent you guys upstairs to kind of plan my visit and stuff, and my wife looked at me and said, I'm sure you don't know how far it is. It was a 6-hour drive, so unfortunately I couldn't make it back in one day. So, but I'm glad I'm able to be here virtually. Again, I was quite glad to see Dr. Harris speak before me. Before I start, I think the people of Watton, myself, owe him a big thank you, because about 18 months ago or so at the NAPC conference, I heard this same talk, and it changed and transformed our lives in Watton. It transformed the way we deliver healthcare in the primary care in Watton, just from that speech he had. And as I go into detail, you probably see why. As a result of the community health workers, we've changed our whole model of care delivery. I know that might sound surprising, but we have. So the community health workers, if you ask me what is probably one single thing I've done in my career, and I've done quite a few weird and wonderful things in my career, but if you ask me one thing that I felt has made a true impact on our patients, is helping to support the implementation of community health workers in our community. So I live in Watton, I work in Watton. It's a small town of about 11,000 people. It's a small market town. Again, lots of people would say probably one of the biggest market towns, dating back over 100 years. So as you can imagine, it is an old quirky town, but as a result of that, we do have a lot of deprivation because we have a lot of factories around, and we often found lots of workload, trying to access our most deprived areas around the town, which, as you can imagine, provided lots of burden for us in terms of workload, admission, looking at patients presenting too late, repeat presenters, and all the challenges that comes with that. And about 18 months, probably about a year ago now, myself and the guys at Brecon Council sat together, and they were able to provide us with some funding for us to have 2 community health workers, and this changed our lives, and I'll tell you how. I think firstly, what suddenly changed was the fact that a lot of the repeat attenders from those areas suddenly disappeared. So the patients that we know on Mondays, usually they'll be the first on the phone or standing outside the door. For some reason, those patients no longer, they just stopped coming, and that was because the community health workers were getting to them before they did, and that was great. Our community health workers have 100% engagement in the areas they cover, and the impact this is having for myself and the rest of my clinical workforce. Again, they can't sing their praises enough, and it's just not just from the health aspect of things, but from the social interaction aspect of it, helping to support their finance, housing, and just to name a few. But I'll give a few snapshots of examples that I thought were quite powerful, just to kind of set the scene. So I think the one that tends to stand out to us was a gentleman that never really prepared to engage with us, and suddenly the community health worker just knocked on his door, and he happened to just open the door by chance, and they found out that he was on the way upstairs to hang himself when they knocked on the door, and straight away they arranged a visit with myself. He came down straight away. We had a chat. We referred him to the mental health team, and it was a guy that didn't really have any real drives, any real goals. And when I first met him, he was pretty much giving up on life, right? And now his housing situation is sorted, better relationship with his son, and I think with the help of the community health workers and the support of the mental health team, his mental health is completely different to where it was about 6 months ago. And this is a chat that when he first came in fact, that initial consultation I had with him, I wasn't so sure that he wasn't going to go home and take his own life. And I had to get the kind of the rescue team involved with him that night. But again, 6 months on, completely different patient. So that is one powerful example. A second example of some of the patient that kind of stands out to us, for about a whole year, we had probably a family that presented repeatedly with us with different illnesses, and they had a child praying. I think she was about probably 12 weeks at a time when she kept coming in, chest infections, cold-like symptoms, just generally unwell. We couldn't find out why, and we had a pending, a pediatric referral as well that we're waiting for. Again, it happened. Luckily, fell into the catchment area of the community health workers. They engaged with the family. As a result of that, they realized that the housing they were in was unsuitable. They realized that both parents were not working. There was a lot of for the children in the household. They realized that they were not really eating properly. As a result of that, they were able to engage with them, provide the right support, rehouse them to a different area now. And in fact, the family's lives were so transformed that when the baby's christening was happening, we got an invite to the christening. That's how much impact the community health workers had. And I think a third patient, just to give you a perfect example, was a patient for over 2 years. She was housebound, bedbound, presented. In fact, she's one of our most problematic patients because we just didn't know what to do with her. Repeated admissions. Again, the health workers, the community health and wellbeing workers got involved with her. And again, I think she's about, you guys, from what I understand from the last correspondence I had, she's just about to move. And the health impact for that is the fact that whereas we're doing a home visit every week to this lady, probably, I think the last time we went was probably a couple of months ago now. And that is the level of impact that these guys are having within our community. And I think what I get from a lot of my GB colleagues and also our nursing team is that, thanks to Tegan and Flo, the things that we would actually have to find out ourselves before we're finding out, they're presenting to us, and then we can solve the problem before it becomes a bigger problem. And the reason why I give this example is just because, for me, I felt at the time, the type of community we are is a close-knit community, and we needed people that would be truly integrated within our community. And we thought the only way to truly build a real One Health system within our community is to have a proactive engagement rather than reactive engagement, and especially for our most deprived areas, which again was identified along with the council and some of our records that we used to identify those areas. We were able to make a true impact because we were engaging with the right people at the right time, for the right appointment. And again, some of the stats that came out from the recent review we did, were very, very, we're so impressive that in terms of in that area, the admission levels had gone down. The practice attendance in those areas had also come down significantly. And just to give a snapshot of some of the health benefits, I think our uptake on smears went up in those areas. Again, health visitor engagement went up in those areas. Health checks again went up significantly in those areas. And the biggest positive for us was whereby previously adult immunization and vaccinations was the lowest in that area of the parts of our town. Now with the help of community health workers, it's probably one of the second best engaged areas in Watton as a result of the impact the community health workers have had. So for me, in terms of trying to drive positive healthcare within our community, integrating them within our primary care system, so they work in a practice, they have access to any what other staff have access to. And with myself, I think we tend to meet almost daily now, which I know it seems like a lot of time, but it's not at all. Daily we have about 10-15 minutes catch up, probably first thing in the morning when I come in, or probably in the evenings maybe. And every Friday we tend to spend about half an hour together, and a lot of that we pick out the patients that we're still struggling to get outcomes for, either health, social, finance, housing, any sort of support they need from us. Again, even making sure that those patients are having the appropriate referrals, occupational health referrals, probably mental health referrals. So again, it's a true One Health system whereby we're all working together within the practice. And the good thing community health workers have done for us is, quarterly so far they've been able to provide the whole clinical team with updates that way, and they're also involved in some of our clinical meetings as well. So I think for me personally, if I say what is one thing that's transformed the way we deliver care in Watton is by implementing the community health workers and wellbeing workers. So that is where we stand at the moment. And the next step for us is what we're going to do next is how do we then make sure that we develop the service and providing at the moment. And as one of my colleagues said, how do we get better? Because at the moment it seems that we're already at the top, but for us it's trying to make sure they closer engage with our care coordinators and our social prescribers, which we've set up I think I called it like a care support MDT, whereby they would have a catch up together just as that three group of people, and then provide us as clinical team with updates on what actions we need to take from that. And yes, I think for us it is the true definition of a one health system. And again, I can only thank and Dr. Harris for that initial conversation that sparked this off for us. And yes, we can't look back, and I think we're looking to I'm trying to convince all of our partners to see if we can roll out to the 2 other practices we have in our PCN. So thank you.